everyone. This is the first episode in the podcast series by Dental Elementary. I'm Raj and I'm joined by the one and only Dr Vinay. So Dr Vinay, can you just introduce yourself to everyone?
Yes, thank you so much, Raj and the Dental Elementary team for having me on this podcast. Really grateful to be here with all of you. I'm Dr Vinay. I graduated from Barts in 2018 with a dental degree. Just about graduated. I did all right, did okay. Then I did my dental foundation training in Northwest London, scheme with Dr Pavan Kumar. Had an amazing time on the scheme and in my training practice. He is a special interest in endodontics. I don't know about you, about university, I absolutely hated endo. But when you get taught by someone one-to-one, it's slightly different and you get to use all the kind of rotary gizmos and gadgets and you end up loving it. And then I just completed my dental core training at Northwick Park Hospital. So people say I haven't actually left the M25 yet. So born and raised in London. And I finished my dental core training in maxillofacial surgery. Just finished that and doing loads of things in between. So yeah,
really, no, it's really interesting because it's always best to find out like what route to go down after dental school. So we just wanted to get to know you really. So just a bit about yourself. So you mentioned you went to dental school in London. How was your dental experience? How did you find university?
Yeah, I absolutely loved it. I went to Barts in London. There's two dental schools in London. There's King's College and there's Barts. When I applied in 2012. I applied to Bristol, Birmingham, Barts and King's. King's, they said, "Oh, you're too good for us. Like you can't come." So I said, "Fair enough. Like it is what it is." King's rejected me straight away. Barts, Birmingham, and Bristol gave me an interview. I did all right at Barts, did okay at Bristol, and Birmingham also said, "Oh, I don't think this place is right for you," and rejected me. But I'm happy to stay in London. It was an absolutely incredible experience. I took a year out and then I went to dental school. So it was great. Yeah, it was fantastic. And yeah, Barts was great. I think it was a new curriculum the year I went because I deferred my entry to Barts. So I took a year out in between, and on the year I was supposed to go straight after A levels, it was like a how do you say it? It was a new curriculum. So anyway, they kind of learnt lessons over that year, and then from my year, it was slightly tweaked. So
guinea pig year a bit.
Exactly.
Oh, cool.
So yeah.
That's cool. So yeah, what got you into dentistry then, like applying? So was there anything else you wanted to do if you didn't go into dentistry?
Yeah, for sure. So I think when you're younger, if it was up to me, I don't want to put, I know this is on record, it's recording, but I think I might make dentistry. I would have made dentistry a postgraduate degree. So I would have made dentistry and medicine a postgraduate degree. Why that is because I read something saying that if at 17, 18, you still have to put your hands up to go to the toilet, I think it's quite hard to make a decision about a long-term career. So I see a lot of my friends, postgraduates, they go into dentistry in a completely different mindset. They've kind of gone through the 3 years of university, undergraduate, then they go to dentistry and medicine in a more kind of focused state. And that's kind of how America do it. So what I had is a kind of a choice between, there's that joke, for Asians, it's either dentistry, medicine, engineering, like accounting or failure. That's it. That's all you get. So I asked all the medics, should I do medicine? And every doctor said, don't do medicine, do dentistry. I was like, okay, I'll do dentistry. I did some work experience, loved it with my dentist, great guy in London. And I also had PPE on one hand, so politics, philosophy and economics. So kind of different things, but it kind of links into my journey a little later on about what I want to accomplish and what I want to do. So yeah, I applied for dentistry. I actually applied on the deferred entry because I knew I wanted to do some traveling before I started dentistry. So yeah, had a
Whereabouts did you
go? So I lived in India for a year actually. Lived in India for a year. and I went traveling all across India, learning about different things, weird and wonderful. So it was great.
Oh, it's an amazing experience. Definitely,
Yeah,
definitely
yeah.
something to talk about. That's
It was
great.
fantastic. Yeah.
That's great. Yeah, I agree with you about the dentistry, because when I started, I was still like a baby almost, going in.
Mm,
And I felt like I think the second year when we started seeing patients, I was only 19. And it's just
mm.
it's a lot of it's pressure on your shoulders almost to just see them patients. So
Yeah.
because you enjoyed dentistry. All in all, I did quite enjoy it. Do you have any
Mm.
advice then for your current dental students, especially now, because obviously everything's changed so much?
It has, and I think the experience that dental students are going to get now, depending on what happens with COVID, is going to be less clinical experience. Um, I think with dental school, it depends on what you want. I didn't realize how many opportunities there were at dental school at the time. There's so many opportunities to actually get involved with research, get involved with different projects, get involved with societies. And I think I would pick three things. I'll pick one research project, one society that you kind of devote your time to. It could be anything. It could be a sports society, it could be religious society, it could be a cultural society, and really get stuck in. And then like one thing that you really like to do that's separate to all of that. So kind of focusing your areas on these different aspects of university, I think you can make the most out of it. I started university 6-7 years ago, and those are the kind of things that I would have done differently. So another thing I would recommend is, I know this sounds really like I'm a dad, but kind of wake up early at university, because I mean, you can have a great time. Obviously, have a great time at university, but waking up early and doing something productive in the morning hours is the best way to get the most out of your time. So I highly recommend that. I started doing that in my 3rd, 4th, 5th year, and I enjoyed university much better. And yeah, that's some kind of simple, basic advice that I'd give.
I commuted to I'm from Manchester, so I used to commute. So my early mornings were literally sitting on the motorway or something,
Oh,
or having
wow.
a cup of coffee or something. But yeah, no, I agree with you. Waking up early, you can get. It's just such a better day. Such a better day.
Exactly.
So you
Exactly.
graduated, you said, barely. But I think you're being a bit modest there. When you did your FD, then you did. The guy was had a special interest in endodontics. So going through your FD year, how did you see the differences between being at university and being in FD? Did you feel more confident, or was it a big step up?
Yeah, for sure. I think I did okay at Barts. I did well, and I gained a lot of clinical skills. But it's known that the first month in your FD year, you probably do more clinical work than you've done at the whole of dental school. So because it's just you and the patients, and then your educational supervisor if you need them.
Yeah.
So you'll do so much in that 1 month, and it'll give you so much confidence. And by the end of those 12 months, you realize, oh, how did I not know all of these things? The study days in your FD year are absolutely incredible. There's 30 different study days that are compulsory, that are kind of equivalent to going on day courses.
Right.
So if you go on Instagram, you see, oh, come on my composite course, come on my implant course, come on my law and education course. So there's so many courses that charge so much money, but in your FD year, you get these study days, which are not the same, but they're similar, and they literally blow your mind about how many things you didn't know. And I think that's the beauty of doing something clinical, because there's always research coming out that kind of shows you the next best thing, and there's always more you can do to improve. So we're not in a career where it's stagnant. You can always keep growing within it. And I think that's something young dentists have to realize, that there's always different pathways that you can follow that are just not known to you yet. And so that's something in my FD year that I was focusing on solely.
Would you recommend then, because you have your study days, which are courses, would you recommend doing more courses, or just stick to your study days?
I think in your FD year, you kind of really have to, the first steps is finding out what you want to do.
Yeah.
There's two types of people at university. There's one person that has absolutely no clue, they're just going along with the flow. And there's the other type of person that's it. I want to do max fax, I want to do endo, I want to do pros, I want to do peri. They know exactly what they want. Both are fine. So in your FD year, if you're the type of person where you know exactly what you want to do and it's being reaffirmed every day because you absolutely love doing those composite veneers or you just love doing endo, then there could be a case for going on a kind of supplementary course. However, if you're not that type of person, I wouldn't worry about going on a course in your FD year. It sounds cliche, but just get the basics right.
Yeah.
What I did, just because it was discounted, I went on a composite 2-day course.
Yeah.
However, it was a great course, absolutely fantastic. But what I realized, my practice and my skills weren't quite, and my patient base weren't quite there yet for me to utilize that course to the max. So I would recommend just sticking to DFT, sticking to the study days that are allocated. And instead of worrying about doing extra courses, focus on that study day and reflect after that study day intensely. Was that for me? Yeah. Do I want to be that guy or girl teaching up there, basically?
So once you finish your FD year then, what made you go to DCT? Because you can obviously, it's either DCT or associate. What made you do DCT and what made you do oral maxillofacial surgery in particular?
For sure. I think most dental core training posts are oral and maxillofacial surgery. So you do 5 years of university in general at dental school, then you do 1 year of dental foundation training, then you do 1 year of dental core training if you want. So that's the kind of hospital pathway. Dental core training is mainly oral maxillofacial surgery posts, but there are other posts like restorative, community, oral surgery, dental public health, etc. So my specific question for doing dental core training was, do I want to be a maxillofacial surgeon? After 3-4 months, I realized the answer is no. But that's okay. That's okay, because it's still an amazing year. You still pick up loads of skills. You still make great friends. You still feel the intensity of being kind of a medical doctor. So it's definitely a fun year. And it opens you up to a whole range of jobs in hospital, because most hospital jobs want to see that you've done a dental core training year in general. So in fact, I had an interview today to do a staff grade oral surgery post at a hospital. So
cool.
just because I've done this kind of dental core training post. So obviously this year was a bit unconventional because dental core trainees were sent to ICU in my case. So we had like 2-3 months in ICU, which was incredible. And so all those people that said, don't do medicine, I hate you, maybe could have considered medicine. It was an absolutely fantastic year. But the kind of takeaway is that you learn a lot in dental core training. And my specific question was, do I want to be a maxillofacial surgeon? And I quickly found out, actually, I don't want to do this for the rest of my life. However, I do want to implement some of the skills I've learned.
Yeah, we did a placement in North Manchester General Hospital in Max. And I was similar to you. It's like, do I want to do it? And after spending 2 weeks there, like, yeah, it's amazing, but I don't think it's something I can pursue further. I think I'm just like stick to teeth. But so, because you mentioned you're redeployed. So what was your day like before COVID, and what was your day like after COVID? You know, like just a typical day.
Sure. So dental core training, it really depends on where you are in the country. So in London, because London has a lot of centres that deal with major trauma and deal with cancer, they generally don't allow the dental core trainees that are singularly qualified. So, you know, to do max fax, you have to do medicine and dentistry to kind of go onto the pathway. Whereas because we've only done dentistry, they don't allow us to do nights in London, because in general, it can be quite dangerous if you're not that highly skilled to deal with the complicated patients that are on the ward. So in general, my day, if I was on call, it would be a 12-hour day. So it would be from 7 to 7. So you get there around 6:45 to the hospital. You do a handover, which means the night person tells you all the different patients that are under the list of MaxFax, whether they're waiting in A&E or they're on the ward. So they kind of give you a handover, and then about 7 to 8, you have a ward round with the registrar or the consultant, and they take you around the ward and they give you jobs for the rest of the day.
Yeah.
And then the rest of the day, you're kind of doing those jobs and you're answering a bleep. A bleep is like a pager you see in all these medical shows like Grey's Anatomy. Yeah, so you're like, and sometimes it can feel like that. Like one time I got a pager and it said, you need to come up to the ward right now, this patient's bleeding. And I'm like, okay. And I was like, maybe they're overreacting. But when I got there, the patient was literally just shooting out blood from their mouth. And I was like, we better call the registrar. And we stopped bleeding. And, you know, it can be quite exciting. But of course, it's like a real step up from dentistry. And then by 7 o'clock, you're absolutely exhausted. And the next day you have to do it again. So, and then there's days where you're on clinic, where you're kind of seeing, if you've done max fax kind of rotations at dental school, you'll see the DCT on a clinic. So you'll be with them on a clinic, seeing patients that need reviews. Either they've had cancer in the past or trauma in the past and they need a review. And then you have kind of theatre sessions, so elective theatre or emergency theatre, which is fascinating. You see big head and neck constructions, you see orthognathic surgeries, moving the jaw backward and forwards, TMJ surgeries, carotid glands, thyroid, so many different surgeries you can see that you generally won't get a chance to see if you stay in general practice. However, remember, the number one rule is, what do you want to do, right? So it doesn't matter if that's not for you, it doesn't make a difference.
It sounds to me, because it's something I'm considering to do. I didn't know exactly what, but because I didn't know a lot of them were max fax based DCT posts. But no, I was considering maybe like restorative. But I'm not quite decided yet. Maybe this year will open my eyes a little bit. So just a bit further in. So you're the founder of Dentify. So I was speaking to one of the lads at Dental Elementary, and we were just talking. We did one by, I think, dental training consultants. It was really good, and it just gave us an insight. And we just wanted to know what you guys have to, or what you're about, what's your sole purpose.
Definitely, for sure. So Dentify kind of started as the Dental Foundation training course. So when I was studying for Dental Foundation training, we did hundreds and hundreds of hours of research on, first of all, the exam, second of all, how to do well in the exam, and then everything you need to know about the exam, if that makes sense. So and it doesn't mean that every DFT student needs to do that, but we did that. And I wanted to know everything about it, just like you would do for a dental exam. However, most people say for DFT, oh, you can't revise, you can't kind of prepare for it. That's true to an extent, but you can definitely prepare hard for it. So we prepared hard. We had a theory about how to do well in this exam. We executed that theory and did pretty well, got a good ranking, got a first choice placement, and thought, well, there is a gap to kind of teach the way that we've learnt. And I felt that was a slight gap in what kind of things can be taught. So we started Dentify to kind of teach people everything they need to know to get their first choice placement. And I called one of my friends on board that also did well, that also got the same scheme as me, like, do you want to go around and teach? So I created the content, we went out, and in our first year, it just started to teach people about DFT. We taught in London twice, Cardiff twice, Plymouth and Leeds. And then the year after that, every single student, they said on an anonymous survey, they would refer that course to a friend. And so we had 150 more people. In fact, we went to Madrid, Belfast, Cardiff, Plymouth, Dundee. We went to, we obviously went to London twice. So we went kind of all across the country, and it went really well. And, our ethos is, you can't practice until you know everything. That was our ethos. That was our kind of thinking. It's kind of like practicing extractions without going through the theory of extractions in a lecture. So we thought, at first comes knowledge, then comes practice, then comes like your goal. So we wanted to give everyone the knowledge. So we had a lecture-based course, went really well. we kind of developed a community that we kind of have small group teaching, and people really loved that, because students in general didn't want to travel so far to go on a course, because it's your final year, it's expensive. So we thought, oh, we'll just come to you. So we went to all these kind of wonderful places, got to meet a lot of students.
Yeah.
And it just developed from there, really. And then, of course, we used the same principles for dental core training, and it went really well again. And so we did a dental core training course to teach similar things. So why this is also interesting for me is because, you know, I was also thinking to do PPE, politics, philosophy, and economics. And so I've always been interested in philosophy. In fact, I used to teach philosophy every week at university. I used to teach about philosophy every week. And that kind of gave me confidence in teaching and how to teach properly and the science of teaching. And then I loved the evidence-based. I know people think, oh, this is really boring, but I love the evidence-based dentistry and the kind of professionalism, teaching, kind of social responsibility aspect of dentistry too. So that kind of fits in with why I like policy and why I like PP and all these kind of different subjects. So when it came to clinical governance and leadership and all these different subjects that had to be taught for DFT, it just came second nature to me. So yeah, that was a bit about dental foundation training, dental core training, the courses we offer. But, you know, as you start going through the motions every year, doing these kind of courses for the last 2 years, I started realizing we're kind of gaining a sort of community naturally. Mm-hmm. So people want to know the next steps, the next steps, the next steps. I want to know the next step. So over the lockdown period, when I was in my hotel room, when I was in ICU, I thought, I want to interview the best dentists in the world and find out what pathway they took to become like that. Because at one point they were all dental students. So what pathways, what kind of things they did to actually become your kind of your Nina Balls or your, you know, Simon Shards or your, you know, the people you see that are kind of excelling in dentistry. So I interviewed all of them and got some amazing feedback. We found out a lot about their pathways that we can also use in our own lives. So kind of Dentify's mission has kind of evolved to help dentists find purpose and passion in their career. And it's kind of moving away from just saying, look, this is everything you need to know about DFT. This is everything you need to know about DCT, which is true. It's still really, really important, to more kind of a holistic program of helping students and dentists find passion and purpose in their career. I think over time, these things seem to dwindle. And, you know, seeing dentistry over the COVID period, a lot of young dentists feel like, oh, am I doing the right career? What else is there to this career? So yeah, so my kind of, that's my purpose with Dentify, and our team has grown by like eight, 9 people, and yeah, it's great.
It sounds amazing. Like I really like how you're taking the bigger picture of it. It's not just DCT, FDA. So I actually watched a few of your podcasts, you know, when you did them. So I saw the Bloody Tooth Guy one, and I saw the Dr. Nilesh Palmer one. I thought they were amazing, like just their journeys and, you know, everything you did into. I thought it was amazing just to learn, because Nilesh Palmer is just something business related. He said that's really helped him with his dental platform. So you've already mentioned it, but they changed the interviews this year, haven't they? Because when I did my interview, I thought there was a big gap in terms of the SJT. I thought people did really well in like preparing you for the interview, but the SJT you were just left on your own sort of thing. So I felt like SJT was a bit of luck almost. So how are you guys going to adapt yourselves to just preparing for the SJT for, you know, the upcoming final year students?
Definitely, I think, you know, CopDent and Health Education England have taken the view that, you know, they have to scrap the interviews that they used to have. So for people watching, interviews used to be a PML and a communication interview. So PML stands for Professionalism, Management and Leadership. You have two assessors that are dentists, and you have a scenario, and you talk about that scenario for 10 minutes. And communication is kind of like your OSCEs. So you have an actor that has a certain problem, and you have to communicate with them. So they're scrapping that because, of course, you don't want people to be in close contact with each other over that kind of long period of time. And they kind of said that they can't do that over the internet either. Although other medical schools, for example, Imperial for medical school, they have an exam called PACES, their PACES exam for 50th students. And it's kind of like an OSCE, but they're also doing that online. But they said that, people have internet issues and people have like microphone issues that could affect their score. So they scrapped that. They've also scrapped so that's what they're doing. So the only thing they're doing is a situational judgment test, and a situational judgment test that evidence-based does show that most students find it a fairer process to kind of rank students or to kind of have a ranking system. But there is still a lot to learn about the situational judgment test. For example, there's a lot to learn about kind of clinical governance, the standards of care, leadership, resilience. There's a lot of kind of small aspects that you need to learn that can actually increase your mark and to do better. Now, there's more to learn for the interview, for sure. However, when we were studying for the DFT, we came up with a few principles that we would use for every single SJT. And so in the Dentify course, we go over these principles. We make sure you know everything first, and then go through loads of practice questions. And the thing is, like, we're really relaxed. Like, we give away all our content afterwards, after the course ends. It's not like, don't take a picture of this, or you can't take our question paper home. I'm like, we don't care. Just take our question paper, make notes on it, go away, learn it, do well in your exam, and then message us when you've done well in your exam, because that feeling on June the 9th or June the 10th or whatever it is, it feels great. Like, we've helped you get your first choice placement. And for us, it's important because, there's people that, for example, go to a university 200 miles away from their family home. They've been away for 5 years. Some of their parents are not well. They have like partners in other parts of the country, and they just want to be back with them. So getting their first choice placement is not just about, oh, I ranked this highly. It's about, I want to be back and look after my mum. And if you go on our Instagram page, you'll see loads of stories like that. So it feels good when they got a place that they wanted close to home or close to a city they want to be. It doesn't matter where you are in the country. Even if you don't rank highly, it doesn't really matter where you are. But if you do want to be in a certain place, then it's important to have the right guidance. And there are loads of courses out there that are reputable, that you can go on. But obviously, if Dentify can help in any way, we're happy to help.
So how are you performing it now then? Because obviously you can't go to people now. So is it over Zoom or something?
No, so actually what you can do is you can go to places. So the government, at one point during the lockdown, I was thinking, it's definitely going to be over Zoom. But, even when I was doing these Zoom webinars and I'd ask, does anyone have any questions? And there's 200 people on a webinar, or even 100 people on a webinar, you don't know these people. It's quite daunting to turn your camera on. Like, before we start this interview, I was like, oh crap, it's going to be recorded. It's going to be on camera. And I'm wearing like just a jumper. But imagine you're a student and you're in a room for a Zoom webinar full of 100 people and you don't know them. It's quite daunting to kind of ask questions. And it's quite daunting to debate the people that are teaching you. Does that make sense? Like, you'll never shout out and go, actually, I don't agree with that. What about this? What about that?
It comes off differently online, can't it?
It can be quite it can be quite hard to kind of debate on an online webinar. And of course, if the government said that, we're not having any conferences, we're not having any kind of courses, then we would have obviously scrapped it and said, we're going to have it over webinar in the safest way, still in small groups. However, the government did say you can have small group teaching. So you see big composite courses, big like diploma companies in dentistry starting up again in a socially distanced way. So we took inspiration from them and said, actually, we can also start up in a socially distanced way. So we got loads of hospitality partners across the country, and we decided to kind of go ahead and do live course teaching. And our method of teaching, anyone interested in education, is called blended learning.
Okay.
So you can't simply learn online, and you can't simply these days just learn face to face. If you have a platform where you can blend the learning, where you have face to face teaching and in small groups, and you have online teaching, then you can kind of blend it together. So we thought we'll have our face to face courses in small groups. We're coming to Manchester this time, so I'm not leaving you guys out. And then we're going to have like a whole mock SJT paper online for people to do, or over a Zoom call, over a webinar. And yeah, we just got our masks. Oh, I wish I bought the mask. We bought loads of kind of face coverings that are unique to Dentify, and we've made sure that safety is our top priority. And that our hospitality partners know that they're completely safe, and everything kind of goes to plan in that way. But yeah, it's going to be a lot of fun. And the teachers this year, of course, I go to teach, but there are other teachers that got their first choice placement when they were doing it and did our course. I'm not sure if you from back. So for the first courses we did in Leeds, in Plymouth, in London, and Cardiff, those teachers, those students that did well, that are just friends now, they're coming back to teach. So we kind of developed that fun community, and they understand our teaching style. It's really intense. The course is really intense, but we've had good feedback, and I'm really grateful for all that.
Cool. So someone wanted
that's enough ranting.
No, it sounds good. I want to do the DCT one, definitely. So to book it then, so if someone's doing DFT, someone's doing DCT, how do they go about booking their place onto Dentify course?
So we have a website. We have a really kind of brand new designed website. It's called www.dentify.education. So you just go onto that website. You can find out all about us. You can see loads of stories. So we call them stories because they're not just testimonials, they're student stories that they've kind of brought out. One girl that came on our course, Neem, I'm going to tell her story really quickly. She went to the University of Leeds this year, and she did our course, and she only did our course in Leeds. She absolutely loved it. And she did her SAT and interviews, and she came 4th in the country.
Wow.
So she did really, really well. And she tells her whole story of why it's important. In fact, the ranking doesn't matter. It doesn't matter at all. The main thing is you get a choice that you want to be in. For example, you're in Manchester, you're back home, you've got a great scheme that you're part of. All schemes are fantastic, but specifically to you, you've got a scheme that you like. So she wanted to be near to London. So she got her first choice scheme, of course. And why she wanted to do that is because she wanted to move in with her boyfriend. They have like a beautiful home near Stevenage, where they have horses, and her boyfriend works in the city. So it was important to her to be close. And she tells the story of telling her dad that she came 4th in the country. And her dad's, has a heart condition. And he called her in the middle of the day saying, "I'm having palpitations because I can't believe you came 4th. Can you help me out?" So they can book it. Like, it's easy to book it. We're all over social media too. And before you book it, just check, is this the course for you too? Like, we don't go for the hard sell. It's completely up to you what you do. But we don't just do a day course. We build a whole community around it. So we make sure that from start to finish, we're contactable. So you can Instagram us, you're part of a special small group that loads of resources are shared on. And then, I think that's about it. Another thing is, of course, we have backing from people that are slightly more senior to me.
Yeah.
And we have their guidance and we have their support. But I think what makes us unique is that we have people that are on the same level as us. Does that make sense? Like, I'm only 2 years older than you, or 2 or 3 years. So I kind of understand what situation you're in. Does that make sense? So I could be quote unquote on the level.
Yeah.
So
Yeah.
I can just tell you how it is. And the students teaching are 1 year younger than me. They can also tell you like, this is how it is, or they probably went to your university too, so they exactly know what you're going through. So in that way, there's no waffle, there's no like patronizing you. It's just, look, Raj, this is what you need to know. This is how you do it. Let us know if we can help. And that's it. And people do well through that. Yeah.
I agree. Yeah, because someone younger as well, you can get on with them more because you think the same generation sort of thing. No,
definitely.
It sounds really good.
And we have some special news coming up. I don't want to say it. It's always good to collaborate with people. It's great to collaborate because you learn so much more from collaboration. But that doesn't mean you collaborate with everyone, right?
Yeah.
You don't collaborate with everyone. So you just pick sensible people that have your best interests at heart, that you want to learn from. And we have some like amazing collaborations coming up, but I'll save that until they're ready to launch.
Okay, so yeah, everyone who's watching, make sure you check out the Instagram for that. So just finally for people watching, price wise, then like is there a certain price? Like is it like just a one-off payment, or like, how did they go about that?
Yeah, so we charge like £99 our early bird fee for our course, and that includes everything. That includes, because you can't charge a student £1,000 to do this. First of all, it's impossible. It's just too expensive. So we just charge £99. That includes all the resources. So remember, like, we give you everything. We don't, even all our slides we give you, and we just say, please don't share them with everyone else. Just keep them to yourself, which most students seem to do. Even if they do, it doesn't make a difference, because the actual experience is coming to the course. Because something might be on the slide, but the knowledge we give you it's like supplementary. All the SJTs we give you, access to the community group for a whole year, it's included in the price. So the early bird's £99, and after the early bird, it's £129, and includes a whole mock SJT paper too. It includes 24 hours access to us if you have any questions. So I think very reasonably priced. And I realized actually you can make, I realized that actually education and teaching and policy and, understanding how to help people in their career is what I'm really passionate about. So you can make more money doing dentistry, but for me, it doesn't give the same level of fulfillment. If that makes sense. It doesn't give like having this. We would never have this conversation if I didn't do teaching. So I think what young students, what I'd give some like a piece of advice is, don't chase the money, chase the experience that you're getting. For example, the hospital job that I applied for, it's not, you'll get paid nothing literally relative to dentistry. Probably 10 times less than a dentist would, but the experience of learning under one particular person will gain you so much insight into that topic. So yeah, chase the experience of learning from that person or a person.
I thought you were going to say, don't chase the money, chase the dream. I've heard that quote.
Oh no, that is
I thought you were going to say that then. No, it sounds really good. The course and everything, it sounds amazing to be a part of. I won't keep you too much longer. We really appreciate your time. You kind of already answered it, but any final words of wisdom for the final year students and the FDs like myself going into FD year, and just what really to make of it, how to handle it, how to approach the year really?
Yes, this is a great question. I think for final year students, of course, I think final year seems scarier than it actually is. You've learned most of the content in fourth year. that you need to know. Final year is kind of a recap year. So I would just advise, do those 3 things that I said in the start. Try and get involved with at least one sort of research project to have on your portfolio. Try and get published in any paper that you can, that you're interested in. Try and network. Instagram has opened up a whole range of networking opportunities that you can talk to the best people in the world about your situation. And at the end of the day, it's all about like having a good time, I think, at university. It's your final year, and then once you go into dental foundation training, it's a great year because you start earning some money and you can pay for things yourself, but it's not the same at university. So for dental foundation trainees, what I'd recommend is, I think you've got 12 months to really start introspecting. Every day for 3 minutes, you should write down, it's really specific. Every day, 3 minutes, write down, what did I learn today? Is this going to help me in my future? Okay. Those 2 things. What did I learn today? Is this going to help? Just for 3 minutes. Everyone's got 3 minutes. That's nothing. So just write it down. You can make a diary, you can make a journal. What things did I learn today? Is this going to help me towards my future? Don't be scared to say yes to loads of things. That doesn't mean you have to go crazy in dentistry. It could be another passion that you're really passionate about. For example, as I keep saying, I'm really passionate about policy, and I applied to do a master's at Oxford in policy and got in, but I'm deferring my entry again for that. So it could be a whole range of topics that you're interested in. Don't let the conventional form of dentistry drag you down. Does that make sense? So don't let the kind of conventions drag you down. Try and think outside the box about what interests you and kind of go for that. Yeah, that's the kind of things I would kind of advise FDs and final year students. But obviously, I'm wishing you all the best in your careers. Again, it's a passion of mine to help you guys with finding passion and purpose in your career. So if I can help you at all, you can always DM me on Instagram. And I look forward to hearing from all of you.
Perfect. Thank you so much, Vinay. Yeah, I'll definitely be message you about DCT. You'll regret saying that in a few weeks' time. So,
no, I'm really happy. I've literally every day at least have at least 10 people message me like, cool. How do I apply for DFT? How do I do this? How do I do that? I'm like happy to help out. Cool. And so is the rest of the team now. So it's great.
That's perfect. So I won't keep you much longer then. Just wanted to say a massive thank you from the behalf of the dental elementary team, from everyone who's watching. You know, we really appreciate your time, everything you've spoken about. It's just nice to get to speak to someone who's been there and done it, and it's not just someone who's just talking about their experiences, but you're actually giving an insight on how to do it, and you're actually teaching the next generation sort of thing of how to get them high ranks. Yeah, just finally a big thank you from behalf of everyone. We look forward to seeing you again. It might not be me hosting, but we hope to see you soon. And any final words you got before we leave?
Yeah, I'm just grateful to the whole team, you and the whole team at Dental Elementary for allowing me to be part of your podcast. And I'm very grateful, and I hope to speak to you soon.